Sarah Martinez never imagined that her quiet Saturday evening shift at Riverside General Hospital would become the night she finally silenced the workplace bullies who had tormented her for months. What started as routine patient care would transform into a medical mystery that only her specialized knowledge could solve, leaving her tormentors speechless and forever changed. Before we jump back in, tell us where you're tuning in from, and if this story touches you, make sure you're subscribed because tomorrow I've saved something extra special for you. Sarah had been working as a registered nurse in the emergency department at Riverside General for 8 months when the harassment began. Fresh out of nursing school with honors from Portland State University, she carried herself with the quiet confidence that comes from genuine competence. Her colleagues initially welcomed her warmth and dedication, but 3 particular staff members quickly identified her as a target. Dr. Marcus Thompson, a second-year resident with an inflated ego and connections to his surgeon father, led the trio. He had grown accustomed to intimidating nurses and enjoyed flexing his perceived intellectual superiority. Beside him stood Jennifer Walsh, a veteran nurse with 15 years of experience who felt threatened by Sarah's fresh knowledge and natural aptitude with patients. The third member was Kevin Rodriguez, a physician assistant who compensated for his own insecurities by putting others down. The bullying started subtly. During her first month, Sarah noticed how conversations would stop when she approached the nurse's station. Jennifer would make comments about book-smart kids who don't understand real medicine, just loud enough for Sarah to hear. Dr. Thompson would dismiss her observations during patient rounds, often cutting her off mid-sentence with condescending remarks about staying in her lane. The situation escalated when Sarah correctly identified a rare drug interaction that Dr. Thompson had missed during a particularly busy night. An elderly patient named Harold Kim had been admitted with chest pains, and Thompson had prescribed a standard beta blocker without thoroughly reviewing the man's medication list. Sarah noticed that Mr. Kim was taking a specific herbal supplement that, when combined with the prescribed medication, could cause dangerous blood pressure fluctuations. When Sarah approached Dr. Thompson privately to discuss her concerns, he exploded. "Are you seriously questioning my medical knowledge? You've been here 3 months, and you think you know better than a doctor?" His voice carried across the emergency department, drawing stares from patients and staff alike. Jennifer smirked from behind the desk while Kevin shook his head in apparent disbelief at Sarah's audacity. Sarah remained calm, pulling out her phone to show Thompson the medical journal article she had saved about the specific interaction. "I just wanted to make sure we covered all the bases, Dr. Thompson. The supplement Mr. Kim mentioned contains compounds that can amplify beta blocker effects." Thompson barely glanced at her screen. "That's exactly the problem with you new nurses. You read some random article online and think you're pharmaceutical experts. Stick to taking vital signs and let the real medical professionals handle the thinking." Despite Thompson's dismissal, Sarah quietly documented her concerns in Mr. Kim's chart and mentioned them to the attending physician during shift change. Dr. Patricia Williams, a seasoned emergency medicine specialist, immediately recognized the validity of Sarah's observation and adjusted the patient's treatment plan. Mr. Kim's condition stabilized overnight, but word of Sarah's intervention reaching the attending physician infuriated Thompson even more. From that point forward, the harassment intensified. Thompson began calling Sarah Dr. Google in front of other staff members, suggesting that she spent her time looking up obscure medical conditions instead of focusing on basic nursing duties. Jennifer would assign Sarah the most demanding patients, and then criticize her for taking too long with each case. Kevin joined in by questioning every medication Sarah administered, demanding she explain her actions as if she were a first-year student. The psychological toll mounted over the following months. Sarah found herself second-guessing decisions she would have made confidently in school. She started arriving early and staying late, hoping to avoid interactions with her tormentors. Her lunch breaks were spent alone in her car, reviewing medical texts to ensure she could answer any question Thompson might throw at her. The breaking point came during a particularly challenging week in November. Sarah had been assigned to care for a young mother experiencing postpartum complications. The woman, Lisa Chun, had delivered her first child 3 weeks earlier and was experiencing severe mood swings and anxiety. Sarah recognized the signs of postpartum depression and spent extra time talking with Lisa, providing both medical care and emotional support. During rounds, Sarah presented Lisa's case to Dr. Thompson, mentioning her concerns about the patient's mental health and recommending a psychiatric consultation. Thompson's response was swift and humiliating. "Oh look, now our little genius thinks she's a psychiatrist too. What's next, Sarah? Are you going to start performing surgery because you watched a YouTube video?" The comment drew uncomfortable laughter from Kevin and a satisfied nod from Jennifer. Other nurses looked away, unwilling to intervene but clearly uncomfortable with the public humiliation. Sarah felt her face burn with embarrassment, but she maintained her professional composure. "I'm just concerned about the patient's well-being. Dr. Thompson, the symptoms she's describing align with postpartum depression criteria, and early intervention can prevent more serious complications." Thompson leaned back in his chair with an exaggerated sigh. "Sarah, this is exactly why book smarts don't translate to real medicine. You're seeing problems that don't exist because you memorized some textbook. This patient is experiencing normal adjustment to motherhood. Maybe if you had some actual life experience instead of just academic theory, you'd understand the difference." The room fell silent. Sarah felt something shift inside her at that moment. Not anger, but a cold determination. She had been quiet long enough, absorbed enough abuse, and watched these 3 individuals put their egos ahead of patient care too many times. She made a decision that would change everything. That weekend, Sarah volunteered for extra shifts. Knowing that the hospital was short-staffed and that her tormentors would likely be working, she had no specific plan, but she sensed that an opportunity would present itself. Her extensive medical knowledge, which Thompson, Jennifer, and Kevin had consistently mocked and dismissed, was about to become their worst nightmare. Saturday evening arrived gray and cold, with the kind of weather that typically brought a steady stream of emergency cases. Sarah checked in for her shift at 6 p.m. Noting that Dr. Thompson was scheduled until midnight, Jennifer was working the overnight shift, and Kevin would be on call. The stage was set for what would become the most satisfying shift of Sarah's nursing career. As she prepared her station and reviewed the patient census, Sarah had no idea that within the next few hours, she would encounter a case so complex and unusual that only her specialized knowledge could solve it. The bullies who had spent months trying to diminish her would find themselves completely dependent on the very expertise they had ridiculed. The emergency department hummed with its usual controlled chaos. Paramedics brought in accident victims. Worried parents carried feverish children, and the elderly arrived with various complaints. Sarah moved through her duties with practiced efficiency, checking vital signs, administering medications, and providing comfort to anxious patients and families. At 8:30 p.m., the ambulance bay doors burst open with an urgency that made everyone look up from their tasks. 2 paramedics rushed in with a stretcher carrying an unconscious teenage boy, followed closely by his frantic parents. The chaos that followed would test every ounce of medical knowledge in the building and ultimately prove that the quiet nurse everyone had underestimated possessed the key to saving a young man's life. Part 2. The mysterious patient. The teenage boy on the stretcher couldn't have been more than 16 years old. His face was pale with a bluish tint around his lips, and his breathing was shallow and irregular. The paramedics, Jake Morrison and Amy Foster, rattled off their report as they transferred him to the emergency bay. "This is Tyler Brooks, 16-year-old male found unconscious in his bedroom by his parents. Initial vitals show blood pressure 90/60, heart rate 45, respiratory rate 8 and shallow. Blood glucose normal at 98, no obvious trauma, no smell of alcohol. Parents report he was complaining of stomach pain and nausea for the past 2 days. Tyler's mother, Catherine Brooks, clutched her husband's arm as they followed the stretcher. "He was fine this morning," she sobbed. "He said his stomach hurt after breakfast, but teenagers always complain about something." Then David found him. Like this when he went to check on him. David Brooks, Tyler's father, looked shell-shocked. "We thought maybe he had the flu. He's been tired lately, sleeping more than usual. We never imagined." His voice trailed off as the medical team sprang into action. Dr. Thompson stepped forward, immediately taking charge of the situation. "Get him on the monitors, start in 4, and draw blood for a complete metabolic panel, CBC, and tox screen. This looks like a drug overdose to me." He turned to the parents with barely concealed irritation. "What substances has your son been using? We need to know everything right now." Catherine Brooks looked horrified. "Tyler doesn't use drugs. He's on the honor roll. He plays violin in the school orchestra. He's never even been in trouble at school." "Mrs. Brooks, with all due respect, kids hide things from their parents. The symptoms are classic: unconsciousness, depressed breathing, low heart rate. We see this all the time with opioid abuse." Thompson's tone was dismissive, clearly frustrated with what he perceived as parental denial. Sarah had been assigned to Tyler's case and was busy connecting the monitoring equipment. As she worked, she listened carefully to the conversation while making her own observations. Something didn't feel right about Thompson's immediate assumption. The boy's symptoms were concerning, but she noticed details that didn't quite fit the typical overdose pattern. Tyler's skin had an unusual quality to it, not just pale, but with a subtle waxy appearance. His pupils were dilated but reactive, which was inconsistent with opioid poisoning. Most telling was a faint sweet smell that seemed to emanate from his breath, barely detectable but distinctly present. Preparing and narrating this story took us a lot of time, so if you are enjoying it, subscribe to our channel. It means a lot to us. Now back to the story. Jennifer Walsh bustled over to assist with the 4 insertion. "Another overdose case," she muttered loud enough for the parents to hear. "These kids today have no idea what they're putting in their bodies. Parents always think their little angels are perfect." Kevin Rodriguez joined the group, reviewing Tyler's initial blood work on his tablet. "Everything looks normal so far, except for slightly elevated white count. Could be fighting off infection on top of whatever he took." Dr. Thompson nodded confidently. "We'll have the tox screen results in an hour. In the meantime, let's start supportive care and prepare for possible naloxone administration if his respiratory status deteriorates further." Sarah continued her assessment, taking a more detailed history from the parents. "Mrs. Brooks, you mentioned Tyler was complaining of stomach pain. Can you describe exactly what he said?" "He said it felt like burning, right here." Catherine pointed to her upper abdomen. "And he mentioned feeling dizzy when he stood up. I thought maybe he was getting sick, like a stomach bug." "Has he been eating normally?" "Actually, no. He's been picking at his food for about a week. We just thought he was being a picky teenager." David Brooks joined the conversation. "But now that I think about it, he's been drinking a lot more water than usual. Always had a water bottle with him." Sarah felt a chill run down her spine. The pieces were starting to form a picture that had nothing to do with drug abuse. She glanced at Tyler's monitoring equipment, noting his heart rhythm was regular but slow, his breathing remained shallow, and his blood pressure was holding steady but low. "Has Tyler lost any weight recently?" Sarah asked quietly. Catherine looked surprised by the question. "Well, yes, actually, his clothes have been fitting looser. We thought maybe he was going through a growth spurt, getting taller and leaner." Sarah's mind raced through the symptoms: weight loss, increased thirst, abdominal pain, nausea, the sweet smell on his breath, and the altered mental status. She needed to check one more thing. Moving to Tyler's bedside, she gently lifted his eyelid and used her penlight to examine his eyes more closely. Dr. Thompson noticed her actions. "What are you doing, Sarah?" "We've already assessed his pupils." "I'm looking for something specific," Sarah replied, continuing her examination. What she saw confirmed her growing suspicion. Tyler's eyes showed signs of dehydration. They appeared slightly sunken, and his mucous membranes were dry. "Dr. Thompson, I think we need to check Tyler's blood sugar again, and also test for ketones." Thompson looked annoyed. "We already checked his glucose. It was normal at 98. This is clearly a toxicology case. Stop wasting time with irrelevant tests." Sarah persisted. "The paramedics checked it with a finger-stick glucometer. Those aren't always accurate, especially in cases of severe dehydration. I'd like to see a serum glucose level from the blood draw." "Sarah, you're overcomplicating this. The boy obviously took something he shouldn't have. We need to focus on identifying the substance and providing appropriate treatment." Jennifer chimed in with a condescending tone. "She's doing it again, Dr. Thompson, reading too much into simple cases. Sometimes a drug overdose is just a drug overdose." Kevin nodded in agreement. The parents are in denial, which is typical. Kids are good at hiding their drug use. We should stick with the obvious diagnosis. But Sarah had noticed something else. Tyler's breathing, while shallow, had a particular quality to it, deep, labored breaths at irregular intervals. It was subtle, but she recognized the pattern from her textbooks. Combined with the sweet smell on his breath, the weight loss increased. Thirst and abdominal pain. She was becoming convinced that Tyler wasn't suffering from an overdose at all. "Dr. Thompson, I really think we should consider diabetic ketoacidosis. Tyler's presenting with classic symptoms: the Kussmaul breathing pattern, fruity breath odor, dehydration, altered mental status. His parents report polydipsia and weight loss over the past week." Thompson's face reddened with irritation. "Sarah, this is exactly what I'm talking about. You're so focused on showing off your textbook knowledge that you're missing the obvious. This boy is unconscious from drug poisoning. We don't need to chase zebras when we hear hoofbeats." "But what if it's not hoofbeats? What if we're dealing with something more serious that requires immediate intervention?" "Enough!" Thompson's voice carried across the emergency department. "You're a nurse, not a diagnostician. Your job is to follow orders, not to play detective. We're treating this as a presumed overdose until proven otherwise." The tension in the room was palpable. Other staff members glanced over, uncomfortable with the public confrontation. Tyler's parents looked confused and frightened, unsure who to trust with their son's life. Sarah felt the familiar sting of humiliation, but this time something was different. This wasn't about her ego or proving a point. A young man's life was potentially at stake, and her medical knowledge was telling her that everyone was looking in the wrong direction. She made a decision that would change everything. While Dr. Thompson continued his overdose protocol, Sarah quietly approached the lab technician who had drawn Tyler's blood. "Mark, when you run the basic metabolic panel, can you also check for serum ketones and maybe get an arterial blood gas?" Mark Rodriguez, the lab tech, looked uncertain. "Did Dr. Thompson order those?" "Not specifically, but they're part of a comprehensive metabolic assessment. If I'm wrong, no harm done. If I'm right." Sarah's voice trailed off, but her meaning was clear. As they waited for the additional test results, Tyler's condition remained stable but concerning. His breathing grew more labored, and despite 4 fluids, his blood pressure wasn't improving significantly. The naloxone that Thompson had administered as a precautionary measure had no effect whatsoever. 20-5 minutes later, Mark returned with results that would vindicate Sarah's suspicions and expose the dangerous tunnel vision that had nearly cost Tyler his life. The numbers on the lab report would prove that sometimes the quiet nurse everyone underestimated possessed the clinical insight that could mean the difference between life and death. The stage was set for a medical revelation, that would silence Sarah's tormentors and establish her as the hero of Tyler Brooks' story. Mark Rodriguez approached the nursing station with a concerned expression, holding Tyler's lab results in his hand. The numbers on the printout would either validate Sarah's clinical suspicions or confirm Dr. Thompson's overdose theory. As he walked past Tyler's room, he could see the young patient's condition hadn't improved despite the naloxone administration. "Dr. Thompson, the additional lab work is back," Mark announced, extending the paper toward the resident. Thompson barely looked up from his chart documentation. "Just give me the tox screen results. We need to identify what this kid took so we can provide the appropriate antidote. The tox screen is still pending, but I have the arterial blood gas and serum ketone levels that were requested." Mark's voice carried a hint of urgency that made Sarah look up from across the room. "I didn't order ketones," Thompson replied dismissively. "We're dealing with a drug overdose, not a metabolic disorder." Sarah stepped forward, her heart pounding. "I requested those tests, Dr. Thompson. Given Tyler's presentation, I thought it was prudent to rule out other possibilities." Jennifer Walsh rolled her eyes dramatically. "Here we go again. Our resident medical expert thinks she knows better than the doctor. This is getting ridiculous." Kevin Rodriguez shook his head in apparent disbelief. "Sarah, you're really overstepping here. Dr. Thompson already made the diagnosis. Why are you wasting hospital resources on unnecessary tests?" But Mark cleared his throat, drawing everyone's attention back to the lab results. "You might want to look at these numbers, doctor. They're pretty significant." Thompson snatched the paper from Mark's hand, expecting to see normal values that would finally put an end to Sarah's interference. As his eyes scanned the results, his confident expression slowly faded. The color drained from his face as the implications of the numbers became clear. "What is it?" Jennifer asked, noticing Thompson's sudden change in demeanor. Sarah moved closer, trying to read the results over Thompson's shoulder. When she saw the numbers, her worst fears were confirmed. Tyler's serum ketones were severely elevated at 4.8 mol/L, well above the normal range of less than 0.6. His arterial blood gas showed a pH of 7.18, indicating dangerous acidosis. Most shocking of all, his serum glucose level wasn't the 98 mg/dL that the paramedics had reported, but rather 487 mg/dL, nearly 5 times the normal level. "The fingerstick glucose was wrong," Sarah said quietly. "Tyler's in severe diabetic ketoacidosis." Thompson stared at the results in stunned silence. The diagnosis he had so confidently dismissed was now staring him in the face with undeniable laboratory evidence. The drug overdose patient was actually a previously undiagnosed diabetic in life-threatening metabolic crisis. "That's impossible," Jennifer whispered, but her voice lacked conviction. She had seen enough lab results in her 15 years to recognize when numbers told an undeniable story. Kevin Rodriguez grabbed the paper from Thompson's hand, scanning the results himself. "These numbers, this is bad, really bad. How did we miss this?" Sarah stepped forward, her voice steady despite the adrenaline coursing through her system. "We need to start an insulin drip immediately, increase his 4 fluids, and closely monitor his electrolytes. Tyler's pH is critically low. He could go into cardiac arrest if we don't correct this acidosis quickly." For the first time since Sarah had known him, Dr. Thompson was speechless. The cocky resident who had spent months belittling her medical knowledge now stood frozen, realizing that his tunnel vision had nearly cost a teenager his life. The stupid nurse he had mocked had just saved his patient and potentially his career. "Dr. Thompson?" Sarah prompted gently. "Should I prepare the insulin protocol?" Thompson's pride warred with his medical training. Every minute they delayed. Treatment put Tyler at greater risk, but admitting that Sarah had been right meant acknowledging that he had been catastrophically wrong. The emergency department around them continued its usual chaos. but their small corner had become an island of tense silence. Yes, start the insulin drip, Thompson finally managed. And call endocrinology for a consult. Sarah moved quickly toward Tyler's room, but she could hear Jennifer's voice behind her, sharp with defensive anger. How were we supposed to know? The paramedic said his glucose was normal. Anyone would have assumed an overdose with an unconscious teenager. Except Sarah didn't assume, Mark the lab tech observed quietly. She looked at the whole clinical picture. Kevin Rodriguez attempted to salvage the situation. Well, it's a good thing we caught it when we did. The important thing is that we're treating it now. But Sarah was already at Tyler's bedside, calculating insulin dosages and preparing the continuous infusion that would slowly bring his blood sugar down to safe levels. She checked his cardiac monitor, noting that his heart rate had stabilized but remained concerning. His breathing was still labored with the deep sighing pattern characteristic of Kussmaul respirations as his body attempted to compensate for the acidosis. Tyler's parents watched anxiously as Sarah worked with practiced efficiency. "What's happening?" Catherine Brooks asked. "Is Tyler going to be okay?" Sarah looked up from the insulin pump she was programming. "Mrs. Brooks, Tyler has developed a condition called diabetic ketoacidosis. It means his body can't properly use sugar for energy. So it starts breaking down fat instead, which creates dangerous acids in his blood." "Diabetic?" David Brooks looked confused. "But Tyler's never been diagnosed with diabetes. Type 1 diabetes can develop suddenly, especially in teenagers. The symptoms you described, the weight loss, increased thirst, fatigue, stomach pain, these are all early warning signs. Tyler's body has been struggling with high blood sugar levels for probably weeks, maybe longer." Dr. Thompson appeared at the foot of Tyler's bed, looking uncomfortable but determined to reassert his authority. "We'll need to monitor him closely for the next several hours. DKA can be unpredictable, and there's risk of complications like cerebral edema." Sarah nodded professionally, but she couldn't help noticing that Thompson avoided making eye contact with her. The attending physician, Dr. Patricia Williams, arrived to oversee Tyler's care, and Sarah provided a comprehensive report of the patient's presentation, her diagnostic reasoning, and the treatment plan she had initiated. "Excellent clinical thinking." "Sarah," Dr. Williams said after reviewing Tyler's chart and lab results, "your recognition of the Kussmaul breathing pattern and the fruity breath odor were key diagnostic clues. This could have been missed easily without careful assessment." The compliment from the attending physician carried across the emergency department, heard by staff members who had witnessed months of Sarah being belittled and dismissed. Jennifer Walsh busied herself with paperwork, suddenly finding her computer screen fascinating. Kevin Rodriguez mumbled something about checking on other patients and quickly left the area. Dr. Thompson remained at Tyler's bedside, ostensibly supervising Sarah's care but clearly struggling with the situation. The nurse he had publicly humiliated for her textbook knowledge had just demonstrated that sometimes textbook knowledge saves lives. As Sarah adjusted Tyler's 4 fluids and monitored his response to the insulin therapy, she felt a mixture of vindication and sadness. She had been right about the diagnosis, and Tyler would recover fully with proper treatment. But the months of harassment and self-doubt had taken their toll, and she wondered how many other clinical insights she might have second-guessed because of her tormentors' constant criticism. Tyler's blood pressure began to improve as the fluid resuscitation took effect. His breathing gradually became less labored as the acidosis slowly corrected. The monitor showed his heart rate stabilizing, and his color was improving minute by minute. "His glucose is coming down appropriately," Sarah reported to Dr. Williams. "We're targeting a reduction of about 100 milligrams per deciliter per hour to avoid complications." Dr. Williams nodded approvingly. "Perfect. Have you arranged for endocrinology to see him in the morning?" "Already done. Dr. Elizabeth Chan will be my first thing to discuss long-term diabetes management with the family." As the immediate crisis passed and Tyler showed signs of improvement, the emergency department returned to its normal rhythm. But something fundamental had shifted in the dynamics between Sarah and her tormentors. The quiet nurse they had underestimated had proven that clinical excellence isn't about hierarchy or ego. It's about careful observation, thorough knowledge, and the courage to speak up when a patient's life depends on it. The night was far from over, and Sarah sensed that her vindication was just beginning. Tyler Brooks' case would become a turning point, but not just for the young patient who would learn to manage his newly diagnosed diabetes. It would mark the moment when Sarah Martinez stopped allowing others to diminish her expertise and started standing firm in her clinical judgment. Word of the dramatic diagnosis was already spreading through the hospital, and Sarah could feel the shift in how her colleagues viewed her. The mockery was being replaced by respect, and the bullies who had made her life miserable were about to discover that their victim was actually the most clinically astute nurse in the department. By 11 p.m., Tyler Brooks was stable and responding well to treatment. His blood glucose had dropped to 320 milligrams DL, still elevated, but moving in the right direction. The dangerous acidosis was slowly correcting, and his parents had finally been able to see some color return to their son's face. Dr. Elizabeth Chan, the endocrinologist on call, had arrived to assess Tyler and begin planning his long-term diabetes management. Sarah completed her hourly glucose check and documented Tyler's improving vital signs. As she updated his chart, she became aware of hushed conversations taking place around the nurse's station. Word of her diagnostic coup had spread throughout the hospital with remarkable speed. "Did you hear about the DKA case in Bed 7? She overheard Lisa Patel, a nurse from the cardiac unit, whisper to her colleague. The new nurse Sarah figured it out when everyone else thought it was an overdose. Really? I heard Dr. Thompson was completely wrong about the diagnosis." Sarah tried to focus on her documentation, but the conversations continued around her. Some staff members glanced in her direction with newfound respect, while others seemed to be reassessing their previous opinions of the quiet nurse who had endured months of harassment. Dr. Thompson had retreated to the physician's lounge after Tyler's diagnosis was confirmed. The resident who had built his reputation on aggressive confidence now faced the uncomfortable reality that he had nearly killed a patient through diagnostic tunnel vision. More troubling was the fact that a nurse he had consistently belittled had saved him from a career-ending mistake. Jennifer Walsh attempted damage control, cornering Sarah near the medication dispensary. "Look, I hope you're not going to make a big deal out of this. We were all just following standard protocol for an unconscious teenager. It could have happened to anyone." Sarah looked at Jennifer with calm eyes. "You're right, Jennifer. It could have happened to anyone, but it didn't happen to anyone. It happened to Tyler Brooks, and he deserved better than assumptions and dismissive attitudes." "What's that supposed to mean?" "It means that when I tried to discuss alternative diagnoses, I was told to stay in my lane. When I requested additional tests, I was accused of showing off. Tyler's life was at risk because everyone was more interested in maintaining hierarchy than considering other possibilities." Jennifer's face flushed red. "You're being dramatic. The kid is fine now. Tyler is fine because we caught it in time. But what about the next patient? What happens when someone's clinical concerns are dismissed because they don't fit into the expected chain of command?" Before Jennifer could respond, Kevin Rodriguez approached, apparently having overheard their conversation. "Sarah, I think you're overreacting. Medicine is a team sport. We all contributed to Tyler's care." Sarah turned to face Kevin directly. "A team sport requires listening to all team members, not just those with the highest degrees. I've been part of this team for 8 months, and my input has been consistently dismissed, mocked, and ridiculed. That's not how I remember it." "Really? Because I remember being called Dr. Google for referencing medical literature." I remember being told that book smarts don't translate to real medicine. I remember suggestions that I lack experience and clinical judgment. Kevin shifted uncomfortably. Look, sometimes the work environment gets a little intense. People say things they don't mean. Intense environments require more collaboration, not less. Tyler's case proved that clinical expertise doesn't correlate with job titles or years of experience. The conversation was interrupted by Dr. Patricia Williams, who approached with Tyler's latest lab results. Sarah, his pH has improved to 7.28, and his anion gap is closing. Excellent management of a complex case. Dr. Williams' public praise drew more attention to Sarah's role in Tyler's diagnosis and treatment. The attending physician's validation carried significant weight in the hospital hierarchy, and several staff members who had witnessed the earlier conflicts began to view the situation through a different lens. At midnight, Dr. Thompson's shift officially ended, but he lingered in the emergency department, apparently reluctant to leave. Sarah noticed him hovering near Tyler's room, checking and rechecking the patient's chart as if searching for some way to rehabilitate his missed diagnosis. Tyler had regained consciousness around 11:30 p.m., confused but alert. His first words were asking for water, which Sarah explained was a positive sign as his body began to recover from the severe dehydration. Catherine and David Brooks took turns sitting beside their son's bed, holding his hand and listening as Dr. Chan explained the basics of type 1 diabetes management. So this isn't something Tyler caused by eating too much sugar or not exercising enough? Catherine asked, her voice filled with maternal guilt. Dr. Chan shook her head reassuringly. Type 1 diabetes is an autoimmune condition. Tyler's immune system mistakenly attacked the cells in his pancreas that produce insulin. There's nothing you or Tyler could have done to prevent it. Sarah listened to the education session while monitoring Tyler's insulin infusion. She had studied diabetes extensively in nursing school, but seeing a family receive a life-changing diagnosis brought the textbook knowledge into sharp emotional focus. The nurse here, Sarah, probably saved Tyler's life tonight, Dr. Chan continued, nodding towards Sarah. Her recognition of the symptoms led to the correct diagnosis. Without proper treatment, diabetic ketoacidosis can be fatal. Tyler looked at Sarah with grateful eyes. Thank you, he said simply, his voice still weak but sincere. The gratitude from Tyler and his family stood in stark contrast to the treatment Sarah had received from her colleagues. Here was a family whose world had been turned upside down. Yet they took time to acknowledge the nurse who had advocated for their son when others had dismissed his symptoms. As Sarah prepared to give her end-of-shift report to the night nurse, she reflected on the evening's events. Tyler's case had validated her clinical knowledge and proven that her months of studying medical literature had real value. But more importantly, it had exposed the toxic dynamics that had made her question her own expertise. The night nurse, Maria Santos, arrived for the handoff report. Maria had worked at Riverside General for 10 years and commanded respect throughout the hospital. As Sarah briefed her on Tyler's condition and treatment plan, Maria listened with the attention typically reserved for physician reports. Impressive diagnostic work, Maria said after reviewing Tyler's chart. I heard Dr. Thompson missed it completely. It was a challenging case, Sarah replied diplomatically. Don't be modest. I've been hearing about this all evening. Word is you stood your ground when everyone else was focused on the wrong diagnosis. Sarah felt a flush of pride mixed with exhaustion. The validation was welcome, but the emotional toll of the evening had been significant. Fighting for a patient's welfare while being dismissed and ridiculed had required reserves of strength she hadn't known she possessed. As she gathered her belongings and prepared to leave, Sarah noticed Dr. Thompson approaching. The cocky resident who had publicly humiliated her now looked uncertain, almost vulnerable. Sarah, could I speak with you for a moment? She turned to face him, wondering what he could possibly have to say after the night's events. I wanted to. That is, I think I owe you. Thompson struggled with words that clearly didn't come naturally to him. You were right about Tyler's diagnosis. I should have listened to your concerns instead of dismissing them. Sarah waited for more, but Thompson seemed unable to continue. His partial acknowledgement fell far short of a genuine apology for months of harassment, but it represented a crack in his arrogant facade. Tyler is going to be fine, Sarah said finally. That's what matters. Yes, but I need you to know that I respect your clinical judgment. The words hung in the air between them. It wasn't the comprehensive apology Sarah deserved, but it was an admission from someone who had never acknowledged being wrong about anything. As Sarah drove home through the quiet streets, she processed the night's extraordinary events. Tyler Brooks' case had become a turning point, not just for the young patient who would learn to manage his diabetes, but for the workplace dynamics that had made her life miserable for months. But Sarah sensed that her vindication was just beginning. The respect she had earned through Tyler's case would be tested in new ways, and she wondered if her tormentors had truly learned from their mistakes or were simply regrouping for future battles. The emergency department was an unpredictable environment, and Sarah knew that proving herself once didn't guarantee permanent change in how others viewed her expertise. 3 days after Tyler Brooks' dramatic diagnosis, the atmosphere in Riverside General's emergency department had undergone a subtle but unmistakable transformation. Sarah arrived for her Tuesday morning shift to find herself at the center of conversations that would have been unimaginable just a week earlier. Dr. Rebecca Martinez, the emergency department director, had requested a meeting with Sarah during her lunch break. The seasoned physician, known for her no-nonsense approach to hospital politics, had apparently heard detailed accounts of Saturday night's events from multiple sources. Sarah, I've been reviewing Tyler Brooks' case, Dr. Martinez began, settling into her office chair across from the young nurse. I have to say, your clinical assessment was exemplary. The diagnostic accuracy you demonstrated under pressure is exactly what we need in this department. Sarah felt a warmth spread through her chest. Recognition from the department director carried weight that extended far beyond individual cases. Thank you, Dr. Martinez. I just followed my training and trusted what the symptoms were telling me. That's precisely the point. Too often, we see healthcare providers get locked into initial impressions without remaining open to alternative diagnoses. Your willingness to pursue additional testing, despite resistance from other team members, shows exceptional clinical judgment. Dr. Martinez leaned forward, her expression becoming more serious. I've also heard some concerning reports about the work environment you've been dealing with. Would you like to discuss those issues? Sarah hesitated. Tyler's case had given her newfound confidence, but she was still processing the months of harassment she had endured. There have been some challenges with team dynamics, but I'd prefer to focus on moving forward rather than dwelling on past conflicts. I appreciate that perspective, but as department director, I need to ensure that all staff members can contribute effectively without facing hostility or dismissive treatment. Excellence in patient care requires collaborative teamwork, not toxic hierarchies. The conversation was interrupted by a knock on Dr. Martinez's door. Kevin Rodriguez appeared, looking uncomfortable but determined. Excuse me, Dr. Martinez. I was wondering if I could speak with you about the Brooks case. Dr. Martinez gestured for Kevin to enter. Actually, this is perfect timing. Sarah and I were just discussing Saturday night's events. Kevin glanced nervously between the two women. I wanted to clarify my role in Tyler's care. There seems to be some confusion about who made the DKA diagnosis. Sarah looked at Kevin with surprise. She had expected many reactions to Tyler's case, but not an attempt to claim credit for her diagnostic work. According to the medical records and witness accounts I've reviewed, Sarah identified the possibility of diabetic ketoacidosis when others were focused on drug overdose, Dr. Martinez stated matter-of-factly. Kevin shifted in his chair. Well, yes, but I was also considering metabolic causes. I mean, we were all working as a team to figure out what was wrong with Tyler. Kevin, the documentation shows that you supported Dr. Thompson's overdose theory and questioned Sarah's request for additional laboratory tests. Dr. Martinez replied, consulting her notes. I may have initially agreed with Dr. Thompson, but I quickly recognized that Sarah was onto something important. I think my experience helped guide her thinking in the right direction. Sarah felt a familiar anger rising, but forced herself to remain calm. Even after Tyler's case had proven her clinical competence, Kevin was attempting to minimize her contribution and claim partial credit for the diagnosis. Kevin, I appreciate your input, but the facts speak for themselves, Dr. Martinez said firmly. Sarah identified classic DKA symptoms that others missed, requested appropriate diagnostic tests despite opposition, and initiated life-saving treatment. Her performance was exemplary. Kevin's face reddened, but he persisted. I just want to make sure everyone understands that this was a collaborative effort. Sarah did good work, but she's still relatively inexperienced. She benefited from having seasoned providers around to support her clinical reasoning. Dr. Martinez's expression hardened. Kevin, I'm going to stop you right there. What you're describing sounds suspiciously like taking credit for another professional's excellent work. That's not collaboration, that's appropriation. I'm not trying to take credit. I'm just providing context about how emergency medicine really works. Junior staff members need guidance from more experienced providers. Sarah finally spoke up, her voice steady but firm. Kevin, you told me I was overcomplicating a simple overdose case. You said I was wasting hospital resources on unnecessary tests. You questioned my clinical judgment in front of Tyler's parents. That's not guidance, that's obstruction. The room fell silent. Kevin's attempt to rewrite history had backfired spectacularly, exposing the very behavior patterns that Dr. Martinez was investigating. Kevin, I think this conversation has run its course, Dr. Martinez said coldly. I suggest you focus on your own clinical responsibilities rather than trying to claim credit for colleagues' achievements. After Kevin left, Dr. Martinez turned back to Sarah with a mixture of admiration and concern. How long have you been dealing with that kind of behavior? Since about my second month here, it's been challenging to maintain confidence in my clinical judgment when it's constantly questioned or dismissed. That's unacceptable. No healthcare provider should have to work in an environment where their expertise is systematically undermined. Dr. Martinez made notes in Sarah's file. I'm implementing some changes to ensure this doesn't continue. Later that afternoon, Sarah was caring for an elderly woman with chest pain when she overheard Jennifer Walsh talking to another nurse near the medication room. Everyone's acting like Sarah discovered a cure for cancer, Jennifer was saying. She got lucky with one diagnosis, and now suddenly she's the department's golden child. I've been here 15 years, and I've made plenty of good catches that nobody talks about. But didn't she save that kid's life? The other nurse asked. Please. Any experienced nurse would have picked up on those symptoms eventually. Sarah just happened to speak up first. The real issue is that she's getting all this attention for doing what any competent nurse should do. Sarah continued her patient care, but Jennifer's words stung. Even after Tyler's case had vindicated her clinical knowledge, the harassment was evolving rather than ending. Instead of outright dismissal, she now faced attempts to minimize her achievement and attribute it to luck rather than skill. The pattern continued throughout the week. Dr. Thompson avoided direct interaction with Sarah, but made subtle comments about beginner's luck and textbook diagnoses that don't always translate to real-world complexity. Jennifer found new ways to undermine Sarah's confidence, questioning her medication calculations and double-checking her assessments in front of patients. But something fundamental had changed. Other staff members who had previously remained silent during Sarah's harassment began speaking up. Maria Santos, the night nurse, publicly praised Sarah's diagnostic skills during a department meeting. Dr. Williams requested Sarah for challenging cases, citing her thorough assessment abilities. Most significantly, patients and families began asking specifically for Sarah's care. Tyler Brooks' parents had written a letter to hospital administration praising the nurse who had saved their son's life. Word of mouth spread among patients, creating a reputation that couldn't be dismissed or minimized by workplace bullies. On Friday evening, Sarah was assigned to care for an 8-year-old girl named Emma Peterson who had been brought in by frantic parents. The child was experiencing severe abdominal pain, nausea, and lethargy. The symptoms were concerning, but initial assessments by the medical team suggested viral gastroenteritis. Dr. Thompson, who was working his first shift since Tyler's case, immediately ordered standard supportive care for viral illness. Classic stomach bug presentation, he announced confidently. 4 fluids, anti-nausea medication, and observation. But as Sarah assessed Emma more thoroughly, she noticed details that didn't quite fit the viral gastroenteritis diagnosis. The child's pain was localized to her right lower abdomen, and she was walking with a slight limp, favoring her right side. Her temperature was only mildly elevated, but her white blood cell count showed a concerning left shift. Sarah found herself facing another moment of truth. Tyler Brooks' case had established her clinical credibility, but it had also made her a target for those who resented her success. Speaking up about Emma's symptoms would mean challenging Dr. Thompson again, potentially triggering another confrontation. As she watched Emma curl up in pain while her parents held her hands, Sarah realized that her personal comfort was far less important than her patient's welfare. The bullies had tried to silence her voice, but Tyler's case had taught her that clinical excellence required courage as much as knowledge. The stage was set for another medical mystery that would test whether Sarah's newfound confidence could withstand continued harassment, and whether her colleagues had truly learned from their previous mistakes, or were simply waiting for an opportunity to reassert their dominance over the nurse who had dared to outshine them. Sarah knelt beside Emma Peterson's bed, carefully observing the 8-year-old's posture and movements. The child lay on her side with her knees drawn up toward her chest, a position that often indicated significant abdominal discomfort. When Sarah gently asked Emma to straighten her legs, the little girl winced and immediately returned to her protective curl. "Emma, can you tell me exactly where it hurts the most?" Sarah asked softly, her voice gentle but focused. Emma pointed to her lower right abdomen, just below her navel. "It started around my belly button this morning, but now it hurts moreover. Here, it feels like someone is poking me with a stick." Sarah's clinical instincts sharpened. The migration of pain from the periumbilical area to the right, lower quadrant was a classic presentation that Dr. Thompson's viral gastroenteritis diagnosis couldn't explain. She performed a careful physical examination, noting that Emma's abdomen was tender to light touch over McBurney's point, and the child showed guarding when Sarah attempted deeper. PALPATION. Dr. Thompson was documenting his assessment at the nurse's station when Sarah approached him with her concerns. "Dr. Thompson, I'm worried about Emma Peterson. Her pain pattern and physical findings aren't consistent with viral gastroenteritis." Thompson looked up from his chart with barely concealed irritation. "Sarah, we've been through this before. Not every case is a rare diagnosis waiting to be discovered. This is a straightforward viral illness. But her pain has migrated from periumbilical to the right lower quadrant. She's guarding on examination, and she's walking with an antalgic gait. These findings suggest we should consider appendicitis." Jennifer Walsh, who had been listening from nearby, interjected with a condescending tone. "Sarah, you can't turn every patient into a medical mystery. This little girl has a stomach bug, just like thousands of other kids who come through here every month." "I understand that common things are common," Sarah replied calmly. But Emma's presentation has specific characteristics that warrant further evaluation. Her white count shows a left shift, and her pain is clearly localized. Dr. Thompson stood up from his chair, his voice rising with frustration. This is exactly what I was afraid of. Tyler Brooks' case has given you a hero complex. You're seeing zebras everywhere because you got lucky once. The conversation was drawing attention from other staff members. Several nurses paused their work to listen, creating an audience for what was becoming another public confrontation between Sarah and her tormentors. Dr. Thompson, this isn't about ego or proving anything. Emma is showing classic signs of appendicitis, and if we're wrong about viral gastroenteritis, we could be putting her at risk for perforation. Kevin Rodriguez joined the group, apparently eager to support Thompson's position. Sarah, you're overthinking this case. The parents said Emma's been around other sick kids at school. Sometimes the simplest explanation is the correct one. But Sarah had learned from Tyler Brooks' case that backing down when patient safety was at stake wasn't an option. Her months of studying medical literature and her careful observation skills were telling her that Emma needed surgical evaluation, not symptomatic treatment for a viral illness. I'd like to request a surgical consult, Sarah said firmly. Given Emma's presentation, I think pediatric surgery should evaluate her for possible appendicitis. Thompson's face reddened with anger. You'd like to request a surgical consult? You're a nurse, Sarah. You don't request surgical consults. You follow the treatment plan that the physician orders. Then I'm asking you to consider ordering a surgical consult based on my assessment findings. Your assessment findings? What makes you think your assessment is more accurate than mine? The emergency department had grown quieter as staff members became aware of the escalating conflict. Emma's parents, Linda and Robert Peterson, watched anxiously from their daughter's bedside, clearly sensing tension among the medical team. Sarah took a deep breath, drawing on the confidence she had gained from Tyler's case. Dr. Thompson, my assessment is based on careful observation of Emma's symptoms and physical findings. She has right lower quadrant pain, rebound tenderness, guarding, and an elevated white count with left shift. These are textbook signs of appendicitis. Textbook. Signs that you read in nursing school? This is real medicine, Sarah, not an academic exercise. But Sarah wasn't the same nurse who had been intimidated and silenced months earlier. Tyler Brooks' case had taught her that clinical excellence sometimes required standing up to authority. Figures who prioritized ego over patient welfare. Dr. Thompson, with respect, Emma Peterson deserves the same thorough evaluation that any patient with these symptoms would receive. If I'm wrong about appendicitis, the surgical team will send her home with reassurance. If I'm right, we could prevent a life-threatening complication. Dr. Patricia Williams, who had been treating a patient in the adjacent room, approached the group after overhearing the discussion. What's the concern about the Peterson child? Sarah quickly summarized Emma's presentation and her diagnostic concerns. Dr. Williams listened attentively, then asked to examine Emma herself. The attending physician's involvement changed the dynamic immediately, as Thompson and his allies couldn't dismiss her authority the way they had dismissed Sarah's nursing assessment. After examining Emma, Dr. Williams returned to the group with a serious expression. Sarah's clinical concerns are well-founded. This child has classic signs of acute appendicitis. I'm calling pediatric surgery for an immediate consultation. The vindication was swift and complete. Within 30 minutes, Dr. Amanda Foster from pediatric surgery had evaluated Emma and confirmed the diagnosis of acute appendicitis. The little girl was taken to the operating room, where surgeons removed her inflamed appendix before it could perforate. Dr. Foster stopped by the emergency department after Emma's successful surgery to speak with the team. Excellent catch-on the appendicitis diagnosis. The appendix was inflamed and beginning to show signs of early perforation. Another few hours of delay could have resulted in rupture and peritonitis. Jennifer Walsh busied herself with paperwork, avoiding eye contact with anyone. Kevin Rodriguez mumbled something about being glad the child was okay and quickly left the area. Dr. Thompson stared at Emma's chart as if it might provide some explanation for his second diagnostic failure in a week. Emma's parents sought out Sarah before leaving for the pediatric ward. "The surgeon told us that you were the one who insisted Emma needed surgery," Linda Peterson said, tears in her eyes. "Thank you for not giving up when we could see there was disagreement among the medical team. You saved our daughter from something much worse," Robert Peterson added. "We could tell you were fighting for her when others wanted to send us home." The gratitude from Emma's family carried even more weight than professional recognition. Sarah had not only diagnosed another potentially life-threatening condition, but she had done so while facing active resistance from colleagues who seemed more interested in maintaining their authority than ensuring proper patient care. Word of Sarah's second dramatic diagnosis spread through the hospital even faster than news of Tyler Brooks' case. 2 life-saving diagnoses in less than a week established a pattern that couldn't be dismissed as beginner's luck or coincidence. Sarah Martinez had proven herself to be one of the most clinically astute providers in the emergency department, but the professional vindication came with a price. Her tormentor's behavior was becoming more desperate and vindictive as their own competence was called into question. Dr. Thompson's missed diagnoses were becoming a topic of conversation among hospital administration. Jennifer Walsh's 15 years of experience meant nothing if she consistently opposed correct clinical assessments. Kevin Rodriguez's attempts to claim credit for others' work had backfired spectacularly. As Sarah completed her shift notes, she reflected on how much had changed Tyler Brooks' case. She was no longer the quiet nurse who absorbed harassment in silence. Emma Peterson's case had proven that her confidence wasn't misplaced. Her clinical skills were genuinely exceptional, and her willingness to advocate for patients was making a real difference in their outcomes. The emergency department's toxic culture was beginning to crack under the weight of undeniable evidence. Sarah's expertise could no longer be dismissed or minimized, and those who had tried to silence her were finding themselves increasingly isolated and discredited. But Sarah knew that transformation of entrenched workplace dynamics would require more than just clinical victories. The final test would come when her tormentors realized that their campaign of harassment had not only failed but had actually strengthened the very person they had tried to destroy. 2 weeks after Emma Peterson's successful appendectomy, the emergency department at Riverside General Hospital had become an entirely different workplace. Sarah Martinez walked through the halls with quiet confidence, her reputation as an exceptional diagnostician now firmly established throughout the medical center. Patients specifically requested her care, colleagues sought her clinical opinions, and medical residents shadowed her to learn from her assessment techniques. The transformation hadn't gone unnoticed by hospital administration. Dr. Rebecca Martinez called Sarah into her office on a Thursday morning with news that would fundamentally alter the department's power structure. "Sarah, I've been reviewing quality metrics for the emergency department, and your diagnostic accuracy rate is remarkable. In your 10 months here, you've identified 3 life-threatening conditions that were initially misdiagnosed by other providers." Dr. Martinez consulted her notes. Tyler Brooks' diabetic ketoacidosis, Emma Peterson's appendicitis, and last week's case where you recognized meningitis symptoms that others attributed to migraine. Sarah nodded, remembering the college student whose severe headache and neck stiffness had prompted her to push for a lumbar puncture despite initial resistance. The spinal tap had confirmed bacterial meningitis, leading to immediate antibiotic treatment that prevented potentially fatal complications. "Your clinical performance has been exceptional, but I'm equally impressed by your professionalism under pressure. Multiple witnesses have reported that you maintained patient advocacy, even when facing significant opposition from colleagues." Dr. Martinez leaned forward with a serious expression. I'm offering you a position as our new clinical education coordinator for emergency nursing. The role involves mentoring new graduates, developing diagnostic protocols, and serving as a clinical resource for complex cases. It comes with a significant salary increase and formal recognition of your expertise. The promotion was everything Sarah had worked toward, but it also represented vindication that went far beyond personal achievement. The nurse who had been mocked as Dr. Google and told to stay in her lane was now being trusted to train the next generation of emergency nurses. I'm honored by the offer, Dr. Martinez. I accept. Excellent. We'll announce your promotion at this afternoon's department meeting. I suspect it will generate some interesting reactions. The afternoon meeting was held in the emergency department's main conference room with all available staff in attendance. Dr. Martinez began with routine announcements before addressing the significant personnel change. I'm pleased to announce that Sarah Martinez has been promoted to Clinical Education Coordinator for Emergency Nursing, effective immediately. Sarah's exceptional diagnostic skills and patient advocacy have made her an invaluable asset to our department. The announcement was met with genuine applause from most staff members, but Sarah noticed the conspicuous silence from her former tormentors. Dr. Thompson stared at the table, his face pale and expressionless. Jennifer Walsh's mouth was set in a tight line of barely contained fury. Kevin Rodriguez looked around the room as if searching for someone to share his disbelief. Dr. Martinez continued. Sarah will be developing new clinical protocols based on her diagnostic expertise and will serve as a mentor for new nursing graduates. Her insights have already prevented several potential medical errors and improved patient outcomes significantly. After the meeting concluded, Sarah was approached by several colleagues offering congratulations and expressing excitement about working with her in the new role. The positive response from her peers stood in stark contrast to the cold reception from those who had spent months trying to undermine her confidence. Jennifer Walsh cornered Sarah near the elevator, her voice low and venomous. I hope you're satisfied with yourself. You've turned this department upside down with your attention-seeking behavior. Sarah looked at Jennifer with calm eyes. Jennifer, my focus has always been on providing excellent patient care. If that's turned things upside down, maybe the department needed turning. You've made enemies, Sarah. People don't forget when someone makes them look bad. I haven't made anyone look bad, Jennifer. I've simply done my job to the best of my ability. If that reflects poorly on others, they should examine their own performance rather than blaming me. Dr. Thompson approached as Jennifer walked away, his usual arrogance replaced by something that looked almost like defeat. Sarah, I owe you an apology. Multiple apologies, actually. Sarah waited for him to continue, noting how different he seemed from the confident resident who had publicly humiliated her months earlier. I was wrong about Tyler Brooks, Emma Peterson, and honestly, about you in general. Your clinical skills are impressive, and I let my ego get in the way of recognizing that. Thank you for saying that, Dr. Thompson. I hope we can work together more effectively going forward. I could learn a lot from your diagnostic approach. The admission from Thompson was more than Sarah had ever expected. The resident who had coined the nickname Dr. Google was now acknowledging that her clinical knowledge was superior to his own. Kevin Rodriguez was the last to approach, looking uncomfortable but determined to save face. Congratulations on the promotion, Sarah. I always knew you had potential. Sarah almost smiled at Kevin's revisionist history. Thank you, Kevin. I hope we can all focus on providing the best possible patient care. As her first week in the new role progressed, Sarah implemented changes that transformed the emergency department's culture. She established protocols requiring thorough consideration of differential diagnoses before settling on treatment plans. She created mentorship programs pairing experienced nurses with new graduates. Most importantly, she fostered an environment where clinical concerns could be raised without fear of ridicule or retaliation. The impact was immediate and measurable. Diagnostic accuracy improved across all provider levels. Patient satisfaction scores increased significantly. Staff morale rose as collaboration replaced the toxic hierarchy that had previously dominated the department. 3 months into Sarah's new role, she received a letter that brought tears to her eyes. Tyler Brooks, now successfully managing his diabetes, had written to thank her for saving his life and changing his family's world. Emma Peterson had sent a drawing of herself as a superhero nurse, inspired by Sarah's advocacy during her hospital stay. But perhaps the most meaningful recognition came from Dr. Patricia Williams during a department grand rounds presentation. The transformation of our emergency department's clinical culture can be attributed largely to one person's commitment to excellence and patient advocacy. Sarah Martinez has shown us that clinical expertise isn't determined by degrees or hierarchy, but by knowledge, observation skills, and the courage to speak up when patients' lives are at stake. The applause that followed was genuine and sustained. Sarah looked around the room at colleagues who now sought her clinical opinions, residents who requested her input on complex cases, and new graduates who looked to her as a role model for professional excellence. The journey from workplace victim to respected leader had been challenging and sometimes painful, but it had ultimately proven that knowledge, determination, and patient advocacy could overcome even the most entrenched toxic behaviors. Sarah's tormentors had tried to silence her voice, but their harassment had instead forged her into an even stronger advocate for excellence in patient care. As she walked through the emergency department that evening, Sarah reflected on how completely her professional life had transformed. The quiet nurse who had once absorbed abuse in silence had become a leader whose expertise was valued and respected throughout the medical center. The bullies who had called her stupid had unknowingly created their own downfall. Their attempts to diminish Sarah's confidence had instead motivated her to prove her competence repeatedly, establishing a reputation for clinical excellence that could never be questioned or dismissed. In trying to destroy Sarah Martinez, they had accidentally created the very person who would transform their workplace into something better than they had ever imagined possible. Sometimes the greatest victory comes not from defeating your enemies, but from rising so far above their level that their attacks become irrelevant. Sarah's medical knowledge hadn't just exposed their lies, it had revealed the truth about what healthcare could become when knowledge, compassion, and courage worked together to serve patients rather than egos. The nurse they had underestimated had become the leader they could never be, and in doing so, had made everyone around her better at the job they all claimed to care about. The emergency department at Riverside General Hospital would never be the same, and that was exactly as it should be. Up next, you've got 2 more standout stories right on your screen. If this one hits the mark, you won't want to pass these up. Just click and check them out. And don't forget to subscribe and turn on the notification bell so you don't miss any upload from us.